The Nurse Licensure Compact, a comprehensive guide to the NLC by Barton Healthcare Staffing. Visit us at our website at www.bartonhealthcarestaffing.com. So, what is the NLC? To get started off with the basics, travel nurses must hold an active license in the state where their patients are receiving care at the time in which the service is provided. The Nurse Licensure Compact, aka the NLC, is a multi-state license which grants registered nurses, licensed vocational nurses, and licensed practical nurses one license to practice in multiple states. The NLC provides important benefits for travel nurses and the healthcare industry in general. For nurses, the NLC opens the door to both in-person and remote telehealth practice without obtaining additional licensure. It also allows travel nurses to practice beyond the border of their home state throughout participating NLC states, and alleviates travel nurses of the monetary, time-consuming, and burdensome costs of obtaining new licenses in every new state of practice. For the healthcare industry, it quickly and effectively expands access to nursing services for patients in underserved and rural communities. It enables nurses to promptly travel across state borders without the need for a declaration of emergency in a natural disaster, and eliminates educators' needs for multiple state licenses to provide online nursing education. You might be wondering why the NLC was created in the first place. Well, the original NLC was created by the National Council of State Boards of Nursing in January of 2000 for two different reasons. The first, to standardize regulations surrounding nursing across multiple jurisdictions to cooperatively protect public health and safety. The second, to minimize redundancies associated with considerance and issuance of every new state nursing license, the result of which would be satisfied nurses and better patient health outcomes. Legislation surrounding the NLC has changed a lot throughout its history. Originally created in 2000, throughout its first 10 years, state members of the NLC grew rapidly, but drastically slowed between the years of 2010 and 2015. The NCSBN attributed this lull to a lack of uniform background checks across states. And to combat the issue, in 2018, the NLC changed and became known as the Enhanced Nurse Licensure Compact, aka the ENLC, which mandated criminal background checks for all applicants upon initial licensure. All previous NLC members had adopted the new ENLC requirements and remain members of the compact today, with the exception of Rhode Island. ENLC legislation since dropped the enhanced part of the name and is now again known as simply the NLC. So, how can you get the NLC? If you live in a compact state and declared it as your primary state of residence when you applied for your license, the license issued should already have a multi-state status. Your multi-state license can be used to practice in any currently participating compact state. Today, 39 states recognize the NLC or are in the process of implementing NLC legislation. Ready to start your travel nurse journey? Get in touch with Barton Healthcare Staffing today. You can reach us through email at info@bartonhealthcarestaffing.com, give us a ring at 1-888-693-9751, or check out our website at www.bartonhealthcarestaffing.com.